So, hello everyone, I'm Laetitia, and today I'm going to use Greek and Latin roots to try and make you guys decipher the origin of different types of cancer. So to do that, we're first going to go through how cells can adapt to their environments and how we can know what type of adaptation they're going through with Greek and Latin roots, and that's going to lead us to kind of understand how to classify different types of cancer. So to start things off, let's take a look at cells. So cells, we know that they're units of our human body, and under physiological or pathological conditions where they might be induced some kind of stress, cells have the ability to adapt to their environments. And these 5 types of adaptations, hypertrophy, atrophy, dystrophy, hyperplasia, and metaplasia, are different ways that the cells can do that. So we're first going to go through what these purple terms here mean. So hypertrophy can be broken down into hyper, meaning over and beyond, and trophy, growth. So hypertrophy is the increased cell size that leads to an increase in organ size. Now, atrophy is the contrary of hypertrophy. Which means without, so without growth. So it's when we have a decreased cell size that leads to a decrease in organ size. And the physiological condition that actually allows hypertrophy and then later on atrophy in life is the uterus. So during pregnancy, the uterus needs to expand to be able to cope with a fetus inside it. So the uterus will go through hypertrophy, but then afterwards, once women go through menopause, we don't need a really big uterus. So the uterus will go through atrophy and become really, really small, even smaller than the normal uterus on the right. And then we also have dystrophy. And dystrophy means difficult growth. And what's important to understand is that dystrophy is the degeneration of cells due to a lack of use, but it's always in a pathological condition. So hypertrophy, atrophy can happen in both physiological and pathological conditions, but dystrophy is usually always pathological. Happens, for example, in neurodegenerative disorders where we don't use our muscles, and that's how we're going to lose muscle mass. Then let's look at words that end with plasia. So plasia means formation. So metaplasia, this term meta means change. So metaplasia is where we're going to have one type of mature cell that will differentiate into another type of mature cell. An example of this is the smoker's lung, where we can clearly see here that we have normal glandular epithelium that produces a lot of mucus to cover the airways. But as someone smokes more and more, the cells adapt to the carcinogen, adapt to the smoke by becoming squamous, by becoming flat cells that can deal with the carcinogens a lot more efficiently. Then finally, we have hyperplasia. So hyper again meaning over, beyond formation. So here we have an increase in the number of cells, which leads to an increase in organ. Now, hyperplasia is different from hypertrophy because here we increase the number of cells, just like in the prostate enlargement process here on the right-hand side. So now that we know and we understand that cells can adapt to their environment, it's easy for us to think that for other reasons, such as genetic reasons and other predispositions, cells can also be triggered to form cancers. Now, what does the word cancer actually mean? So around 400 BC, the Greek physician Hippocrates first described the mass of cancerous cells as karkinos, the Greek word for crab, because the swollen blood vessels around a tumor reminded him of a crab. But it was only around 47 AD that the Greco-Roman philosopher Celsus translated the Greek word to the Latin word we use today as cancer. And then finally, in 200 AD, that's when the term oncology came in to deal with the field of medicine. It was the Greek physician Galen that applied the term onkos to describe any tumors, both malignant and benign. And since then, we still use the same word to classify this discipline of medicine. So cancer, the word itself, has no scientific meaning. And what I mean by that is that cancer scientifically is a malignant neoplasm. So what's a neoplasm? New plasm, molding, formation. So a neoplasm is the autonomous new growth of abnormal cells. And this new growth can have three types of behavior. A neoplasm can be benign, borderline, or malignant. And it's important to understand that cancer, what society knows as cancer, is a malignant neoplasm. And there are different ways that we classify and that we can detect using Greek and Latin roots whether the neoplasm is benign or malignant. So benign comes from the Latin bene and genus, which means born, birth. So benign is something that is born well. Dysplasia, again, this meaning difficulty, difficult formation. And then malignant neoplasm comes from the word malignus, which means mal, bad, and genus, to be born. So a bad birth. And if we apply that physiologically to what happens in our body with either a benign, a dysplasic, or a malignant neoplasm, a benign neoplasm is when there is no metastasis, so no change in place. Everything is settled, there's a cap around the tumor, and we're safe. Dysplasia is when we're going to have a precursor of cancer because there's going to be this local destructive growth. So this difficult formation simply implies that there's this local destructive growth. And finally, malignant neoplasm is when we're going to have metastasis and the cells will look different to the tissues from which they arose from. So that's why we say that it's bad, because it looks different to the tissue that, the tumor looks different from the tissue that it arose from. Now, of course, this classification is really oversimplified, but it's easy to remember that benign, no metastasis, malignant, metastasis. Now, neoplasm will always have the suffix oma, which also means tumor, which also means swelling. And there's two different types of neoplasm based on which cells they come from. So if we have a malignant neoplasm, so a cancer that starts in the epithelial layer of our human body, that's called a carcinoma. And the word carcinoma itself is just another way of saying the Greek word karkinomos, crab, for cancer. Whereas if we have a mesenchymal neoplasm, mesenchymal being the middle cellular tissue of our body, basically all the soft tissues in our body, a malignant neoplasm from the mesenchymal layer will have the word sarcoma in it. So carcinoma, a cancer from the epithelial, sarcoma, a cancer from the mesenchymal layer. So if we now look even deeper into the neoplasm of the epithelial origin, there are two classes. We can have squamous epithelial malignant neoplasm, and we can have glandular malignant epithelial neoplasm. And here, these examples are just set out for you to really see that as soon as we're talking about something that's malignant, as soon as we're talking about cancer, the word carcinoma pops into the name of the cancer we give. Same for if we take the example of glandular cancers, a benign glandular neoplasm will be an adenoma, but as soon as it starts metastasizing, we will call it a gland carcinoma. Now, the neoplasm of mesenchymal origin, we can also apply that same logic. So if we take, for example, here, neoplasm from the striated muscle layer that has a suffix rab, a benign tumor will be called rhabdomyoma. So myoma, we have a neoplasm, rab, a neoplasm from the striated muscle layer, whereas if we have something that is malignant, we will call that rhabdomyosarcoma. So here, the word sarcoma implies that it is cancer, it will metastasize, this is bad news. And this logic can be applied to many different categories of the soft tissues that we're talking about, including adipose tissue with the suffix lipo, blood vessels, angio, bones, cartilage, and the only exception that is worth knowing would be melanocytes. So a mole, these little brown dots that we have, that everybody has, it's called a nevus. And the malignant cancer of the melanocytes will be called a malignant melanoma and not a malignant sarcoma. All right, I hope that was really useful. Thank you. Bye.